Any idea what we are going to discuss today?
Ma'am, we'll be discussing our communication skills with our fellow batchmates and teachers.
Thank you. Thank you, Parneet, for responding. What about others? Is this communication, what you're doing? What you're doing, is this communication or no communication?
No communication.
Ayush, even this is communication. You know this?
Yes, ma'am.
When you're not responding, even that's a communication. And that's a huge communication. So when you give a call to your friend and that person does not pick your call, is it a communication or no communication?
Communication, ma'am.
Communication.
Communication.
What is that communication?
That the person does not want to talk.
Wow. So when you don't answer in the class, what communication are you trying to make to me? Do you want to give me this communication or no? I'm misunderstanding. Say something, please. Kiran, what do you say? Do you want to communicate to me that you are not listening and you are not attending, or you are just physically sitting there? What do you want to communicate to me, Kiran? Please unmute your device and respond. Okay, so let me inform you that this is an interactive session. If you're not interested in responding, I would not want you to be here. I would exit you, and once I remove you, you will not be able to join. Also, please remember that this is a recording which is going to go to your college, and I mean, they would know what we are doing in the program, because it doesn't have to be done just for the eyewash. It has to be done in an interactive manner where we all participate. So you got to take the responsibility of participating if you want to be here. If you don't want to be here, if you don't want to participate, then it's better if you are not there, and only those few who are keen to participate happily, who want to really learn, they can stay. Others can actually exit. I'll be more than happy to have only those handful of students who are really interested to participate. Just to let you know, I'm not in India right now. You are in your comfort zone. It's 2 p.m. in India right now. I'm in US and it is 4:30 a.m. 4:30 a.m. So to take this class at 4:30 a.m., I got up at 3 a.m. in the morning to be with you. But I would only be happy to interact with those few of you who are really keen to learn. And you can very well evaluate your own communication skills when none of you is responding. None of you is giving any acknowledgement. What communication are you making? And if this is what you're doing even in your classroom, just imagine your teacher's interest in teaching you. So you can't blame your teachers tomorrow that they are not teaching effectively. Teaching and learning are simultaneous processes. Teacher would teach you, learning has to be done by all of you. But if you don't participate, if you don't answer, if you don't ask questions, if you don't give them feedback, it'll be more like one-way traffic. Can you call somebody continuously and wait for that person to pick the call? And if that person does not pick the call, you will still keep calling that person? Will you do that?
No, ma'am.
No, ma'am.
No, ma'am.
You would.
No, ma'am.
So please remember, a lot of effort is being made to run this program for all of you. For the last almost 6 months, we have been working on organizing this program for all of you. A lot of effort has gone in by your director, sir, by your teachers, Dr. Uditi, Dr. Khalid, because they were very keen to have this program for all of you. They have been regularly in touch with me. Initially, I was supposed to visit Jammu and do this program, and then slowly it got, delayed. Then it was decided we'll do it, but we'll do it on Zoom. And for me, it's exactly the opposite time zone. I said, even that's okay with me, because most of my programs I'm doing every day early in the morning, so I can do it for you. But then I want you to participate. Can we participate?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes,
Thank
ma'am.
you. Thank you. Thank you so much. Thank you. So please be available. Your camera has to be on. That's mandatory. Be seated in a place where you can comfortably participate. I know you are at home. So at times, there are people around, so you're not able to, freely answer or ask questions. So preferably sit in your study room or in a place where you can, speak comfortably, where you can ask questions, where you can express your doubts. So that's the whole agenda. Before we begin, let me give you a quick outline of the program. There'll be a small technology reminder just to tell each one of us how we are supposed to be behaving in the session. And some of you are often on switching off your camera and switching it on. So that's causing disturbance on my laptop. And I'm not able to focus because I'm not carrying any notes in my hands. I have to just speak. So first of all, please do not switch off and on your camera. If that happens frequently, then I'm really very sorry. I'll have to remove you because it's causing to disturb me. So sit at one place and then have your camera on. And also, some of you have not logged in with your proper name. So I need to have your name in front of your, picture so that I know your name, and also that will go as your attendance to your teachers. So please make sure that you write your proper name, on the screen. That should be visible. So after the technology reminder, we will spend around 10 minutes on introduction. So each one of you will have 30 seconds to introduce yourself. I want to see how best you can introduce yourself in those 30 seconds. So before I do that, I give you 1 minute time to write your introduction. And after the introduction activity, I'll tell you the reason why I'm asking you to write your introduction and introduce yourself in the most impactful manner. And why I'm asking you, we'll talk about that. Then of course, we discuss the interpersonal and communication skills. It's going to be an interactive session, a lot of question answer, a lot of points that you will be coming out with. I'll be just asking you a couple of questions and you will be working on them. I can see somebody with one plus nod CE5G. I can't see your proper name. Do you know how to change your name?
No.
Okay, so there are 3 buttons on the right side. If you will look at the screen.
Yes, ma'am.
Press that button, it gives you an option to rename yourself.
No, ma'am. कोई option नहीं दिखाई दे.
It's not giving you the option. Then I will ask you to exit, and when you log in with your proper name.
Okay, ma'am.
Because you have logged in from mobile. So
Yes,
if you log in from mobile, you will not be able to see each other. I can see a couple of you have logged in from your mobile. Even Kiran, you have used mobile. Parneet, you have also joined through mobile. It's better if you join your laptop. Parneet, is it possible for you to join from your laptop?
Ma'am, I have joined through my iPad.
But are you able to see everyone?
Yes, ma'am.
Okay, great. Kiran, what about you? Unmute your device when you're speaking, please.
हाँ मैम लैपटॉप से हो सकता है.
तो आप एक बारी लॉग आउट करके लैपटॉप से ज्वाइन करो so that you can see everybody. See,
Okay,
it
ma'am.
has a virtual classroom, no? So it's better if you join. So all of you who have joined, Rahul, आपने भी मोबाइल से ज्वाइन करा हुआ है, if I'm not wrong. Rahul, राहुल झाजरा, am I right? ठीक बोल रही हूँ राहुल? आपका नाम ठीक बोला मैंने?
Yes, ma'am. Sorry, ma'am,
आप-
I am not able to join with laptop.
कुछ चैलेंज आ रहा है कुछ?
Ma'am, I am not carrying my laptop because I am present in library, and the laptops are at my home.
मैंने इसीलिए ग्रुप में ये मैसेज डाला था, प्लीज ज्वाइन फ्रॉम योर लैपटॉप and not from your mobile, because then you will not be able to see each other, which is very important to have a feeling that we are in a classroom. Okay, so I can see 16 of us here, and 2 of you are not having your camera on. So those who are not having your camera on, I'm really sorry, I'll have to exit you, and then you will not be able to join this program. So you have to take a call whether you want to. So I had sent a questionnaire on communication style. Do you have that questionnaire with you? And have you all done it?
Yes, ma'am.
Yes,
ma'am.
ma'am.
Yes, ma'am.
Who all have not done, please raise your hand. Anybody who has not done, please raise your hand. Okay, everyone has done it. Okay. So I can see only 16 of us with our camera on. One of you is. Thank you.
Excuse me, ma'am.
Yeah, go ahead.
Ma'am, my notebook's in the other room. Can I just go grab really quick?
So good. And it's not just for you. Everybody, please get your copy and pen, because you will be doing some activity by writing. And also, as I'm asking you to introduce yourself after thinking about yourself and writing, that will be a good idea. Thank you. Thank you, Prachi, for reminding. Everybody can take their copy and pen ready. Yeah, keep it ready. You can get up, go and get your. So I'll wait for few seconds. By the time you get your copy and pen, everybody has a copy and a pen?
Yes, ma'am.
Yes, ma'am.
Anybody who wants to go and get up and get the
Yes.
copy?
Yes, ma'am.
Sure. Thank you. Any idea what is the time now? $2:20?
Ma'am, it's 280.
218 PM.
So just, if we round it, it's around 2:20. So how much
Yes.
time have we lost by now, since we have not started the session? Any idea how much time we have lost now?
20 minutes, ma'am.
20 minutes.
20 minutes.
20 minutes?
Yes.
Multiply 20 with 17. If anybody has calculator, 340.
340.
40.
40 minutes. Divide 340 by 60.
5.67.
So we have not lost 20 minutes. We have lost 6 hours. The cumulative loss is not 20 minutes. It's 6 hours that we have lost in the bargain to make you speak, open up. And for a class of say 1 hour, if you lose initial, say 10 minutes, when your teacher comes and finds something that's not okay and she speaks about it, you lose a lot of time in that process. So being proactive, being ready to attend, being ready to align yourself with your teacher, I think it's one of the primary responsibility you have right now, because you are still not doctors, you are medical students. So as a student, if you know your role, I think a lot can be done in the session. But thank you for understanding and being there. Okay, so I am going to share the screen just to quickly have the technology reminder for all of us so that we know what is expected from all of us. So as I said earlier also, please join from your laptop and not your mobile. Keep the gallery view on so that you can see everyone. Keep your video on so that we can see you and interact with you. If you are not visible on the screen, there's a possibility I will miss to see you, which I don't want to do. I want each one of you to be physically, mentally present there. Keep your device on the mute mode. If you want to speak, unmute and then go back to mute mode, because sometimes there's a lot of noise from the background and that disturbs the session. In case if you're moving or changing your place, for those couple of seconds, you can switch off the video. In case if you're changing your place, preferably it's better if you sit at one place and, you know, and attend this session. There will be things in the chat box. Please respond to the prompt in case if there's a message or something. Keep an eye on the chat box. Rename so that we know what is your exact name, and that will go as your attendance for the session. There are certain ground rules that I think we all must respect. One is that please speak for yourself and be mindful of others. Confidentiality, whatever we discuss in the room stays in the room. Stay engaged, and for that reason, I asked you to keep your video on so that you don't get distracted. So share your experience. We are all here to learn. And even when you are giving an answer or feedback, please be specific and non-judgmental. Trust is earned and it takes time. I know we are interacting for the first time, so you will take little time to develop trust in the program, in the session, in me, but that's perfectly all right. We will wait for that to happen. So I would give you 1 minute to prepare for introduction, and then each one of you have to introduce yourself in 30 seconds. So I want somebody to time. The moment it is 25 seconds, that person will say time up, and the person gets another five seconds to complete the introduction. So what exactly? Tell something about you, what you are fond of, and then pass the baton to the next person. So if I may quickly introduce myself, I am founder director, Indian Institute of Healthcare Communication. This is one organization that is working in the field of healthcare communication. So I'm training doctors, nurses, and paramedical staff in their communication and interpersonal skills with the patients and fellow colleagues. So I'm visiting faculty to a number of organizations. Working with medical colleges, I have worked on developing a book called Fundamentals of Clinical Communication for all of you. If you get a chance to lay hand on this book, it will be a very good guide to learn how to go about handling your patients. And this book has been priced a very, very nominal price, something like less than a cost of a pizza. So I would recommend each one of you to, have your personal copy of the book. So this is in brief about my introduction. I pass the baton to Preeti to introduce herself. But before that, I think I would give you a minute time to think about your introduction, and I'll tell you why I'm asking you to think and give your introduction. So your 1 minute starts now. Yeah, you can write in your notebook and be ready. Time's up. Do you need more time?
Ma'am, my name is Preeti Gupta. I am a medical student studying in AIIMS Jammu.
Preeti, hold on. So who will do the timing? Who will keep a record? Can somebody take the responsibility?
Ma'am, I'll do it.
Thank you, Prachi. So please have your stopwatch ready. So moment it is 25 seconds, please give a reminder, time's up, so that within next 5 seconds.
ma'am.
So tell me whenever you're ready, Prachi. You're ready?
Ma'am, you can start.
Okay, yes, Preeti, go ahead.
Ma'am, my name is Preeti Gupta. I am living in Khairtal Alwar, Rajasthan. I am a medical student from studying in AIIMS Jammu, and I want to be a doctor in future. And
Time's up.
Thank you. So Preeti, whom do you nominate after you to speak?
yeah, ma'am.
Sorry?
क्या पूछा आपने सुना नहीं?
प्रीति किसको नॉमिनेट करते हो कि आपके बाद कौन बोले?
मैम प्रणीत.
Okay. Go ahead, please, Praneet.
Yes, ma'am. Good afternoon, everyone. My name is Praneet Kaur, and I'm a student of first year MBBS at AIIMS Jammu, and I belong to Patiala, Punjab. And my hobbies include dancing and writing articles and poems related to social issues that are prevalent in the society. And I love to express my emotions through dance. And I also like giving public
Time's up.
speeches, and
You can complete that. You have 5 seconds.
I also like giving public speeches. And basically, I am a socially extroverted person.
Thank you. So whom do you nominate?
Ma'am Manya Chauhan.
Yes, Manya, go ahead.
Good afternoon, everyone. My name is Manya Chauhan, and I'm a student at AIIMS Jammu, currently in first year. I am from Dehradun, Uttarakhand, the land of gods. And my favorite pastime is painting and doing creative stuff, which makes me happy. And I can be a good listener at times to my friends and family. I'm from.
You can complete that. You have 5 seconds. Yeah.
I'm fond of traveling and gaining new experience, and I nominate Nishant Kumar.
Thank you. Yes, Nishant, go ahead. Nishant, unmute your device, please. Nishant, unmute your device. Yes. Yeah.
Good afternoon, everyone. My name is Nishant Kumar. I am a student of AIIMS Jammu in first year, and mean of my name is the end of night, which means after every darkness, the bright morning is waiting. And I am interested in poetry.
Interested in? Nishant, what are you? Poetry. Okay, thank you. Thank you. So, whom yeah, Nishant.
कन्हैया.
निशांत किसको नॉमिनेट करते हो कि आपके बाद कौन बोले?
कन्हैया.
Yes, Kanhaiya.
Good afternoon, ma'am. Myself, Kanhaiya Chimpa. I am a student of AIIMS Jammu first year batch, and I belong from Bikaner, Rajasthan. My hobbies are playing cricket and pass time with my friends.
Thank you. कन्हैया किसको नॉमिनेट करते हो?
Mridul Agarwal.
Yes, Mridul, go ahead.
Good afternoon, ma'am, and my fellow batchmates. Thank you for giving me opportunity to introduce myself. My name is Mridul Agarwal, and currently I am pursuing MBBS from AIIMS Jammu. I belong to Jammu city, Jammu and Kashmir, and my hobbies are playing cricket, and I am fond of gaming. I like to spend time with my friends and family.
Time's up.
Anything important? Mridul, you are left to speak.
No, ma'am.
Okay. So, whom do you want to nominate after you?
Ma'am, Munish.
Yes, Manish, go ahead.
Good morning, everyone. My name is Munish Kumar. I am from Kathua, Jammu and Kashmir. I have done my schooling from Army Public School, Janglot, and now I am pursuing my MBBS from AIIMS Jammu. Now coming to my hobbies, I love to play football, traveling, and read books. Thank you.
Thank you, Manish. Thank you. Whom do you nominate, Manish?
I'm Shami.
Sorry, I didn't get the name.
Shami, Mohammad Shami.
I can't see anybody.
Then Mohit Garg.
Mohit, go ahead, please.
Good afternoon, ma'am. My name is Mohit Garg, a first year MBBS student of AIIMS Jammu. I belong to Bathinda, Punjab. My hobbies are playing badminton, table tennis, drawing, and traveling and exploring new areas. My main motive of life is to become a good doctor and help others.
Thank you. Wonderful, Mohit. Thank you. Whom do you nominate?
Meena Kumawat.
Yes, Meena, go ahead.
Hello everyone, I'm Meena Kumar from Rajasthan, India, and now I'm a professional student, first year professional student at AIIMS Jammu. My hobbies are dancing, painting, and singing, and I like to listen poems and writing. Thank you.
Thank you, Meena. Whom do you nominate?
Kiran Meena.
Yes, Kiran, go ahead.
Good afternoon, everyone. My name is Kiran Meena. I am from Jaipur, Rajasthan. I am a student of AIIMS Jammu in first year batch.
Tell us more about you, Kiran. That's all?
Yes, ma'am.
Okay. Whom do you nominate?
Payal Kamal.
Payal, go ahead.
Good afternoon, ma'am, and good afternoon, everyone. Myself is Payal Kawar. I am belongs to Juru, Rajasthan, and I am student of first floor of AIIMS Jammu. And my hobbies are dancing and exploring the new areas. And I want to be a good doctor, and I am happy to be a part of AIIMS Jammu and medical family. Thank you.
Thank you, Payal. Very good introduction. Whom do you nominate, Payal? अभी बहुत सारे लोग रह गए, राहुल रह गया, आयुष रह गया, प्राची रह गई, am I right? है ना? लविश रह गया। किसको नॉमिनेट करते हो? पायल बोलो।
Lavish Batra.
Okay, Lavish, go ahead.
Hi everyone, I am Lavish Batra. I am a first year medical student. I am born and raised in Ludhiana and I actually belong to Punjab. Medicine is my passion, and one thing I would like to change among the masses during my lifetime is to focus the shift towards preventive medicine. One quote that I live by is, yesterday I was intelligent, so I wanted to change the world, but today I am wise and I want to change myself. Thank you.
Thank you, Lavish. Very interesting introduction. I like it. Whom do you nominate?
Thank you, ma'am. I would like to nominate Prachi Narwal.
Okay, Prachi.
So good morning, ma'am, and good afternoon to everyone else. I am Prachi Narwal, an undergraduate MBBS student at AIIMS Jammu. I'm from Karnal, Haryana. Okay, so dancing is something which gives me immense happiness. And I also like watching sky, watching sunsets, and stargazing. That's it. Thank you.
Thank you, Prachi. Whom do you want to nominate?
Prachi Mal.
Okay, Prachi. Is there another Prachi? Oh, okay. Sorry. I forgot my timekeeper. Yes, Prachi, go ahead.
Good afternoon, everyone. My name is Prachi Mal, and I belong to Jalandhar, Punjab. My hobbies include dancing and listening to music. And I'm currently an MBBS first prof student at AIIMS Jammu, which I'm very happy to be a part of. And I'm very fond of making new friends, which I'm halfway actually trying to make new friends in hostels, and also looking forward to be friends with everyone here.
Thank you, Prachi. Thank you. So whom do you nominate, Prachi, to introduce?
Ayush.
Yes, Ayush, go ahead.
Good afternoon, ma'am, and good afternoon to everyone, my classmates. I'm Ayush Kumar. I belong to Gaya, Bihar, the land of enlightenment. My hobbies are dancing, playing footballs, cycling. I like the most. And I am a socially extroverted person. I like to make friends, as many as I can. And I'm currently pursuing my MBBS from AIIMS Jammu, and I love my campus. Thank you.
Wow. Thank you, Ayush. So whom do you want to nominate? Who all are left? I think Rahul is left. Raise your hand.
Rahul,
yeah, but can I, Rahul, and who all are left? Anybody else who is left?
Mansi.
Mansi. Okay, yes. So after Rahul, Mansi. Go ahead, Rahul.
Good afternoon, ma'am, and my best mates. Myself, Rahul Jayara, and I am from Pink City, Jaipur, Rajasthan. I pursue my MBBS in AIIMS Jammu, and I hobby in playing cricket, and sometimes I like this dance, and I am only who doing this MBBS in my family, and this is a great pleasure, and this is great pleasure for me taking this opportunity, and I think this is make inspire for upcoming generations.
Time's up.
Wonderful. Thank you, Rahul. I think you spoke very well. किसका मानसी अब आपकी बारी है मेरे ख्याल से. Is there anybody else who is not introduced? Okay, yes, Mansi, go ahead, please.
Good afternoon, ma'am. Good afternoon, everyone. Myself, Mansi. I belong to Hanumangarh, Rajasthan. I am an MBBS student at AIIMS Jammu. My favorite pastime is listening music. I also love exploring new places and traveling around. I like natural places very much. Thank you.
Thank you. Thank you, Mansi. Thank you. So how did it feel to introduce yourself? Write your thoughts in the chat box. I know some of you can answer, but if you'll write in the chat box, I'm sure we will have more answers. How did it feel to introduce yourself? So just don't write felt good or not good. Of course, I know that's one good feeling, but anything special that you experienced when you introduce yourself. Good, but I think we have to improve something in our introduction. Absolutely, Kanaya, you're right. It's really great experience. It felt good to stop for a second and have a look at my own self, to have a moment of self-introspection. Yes, absolutely. It felt good to introduce ourselves and even know better about our batchmates. Absolutely. Yes, Nishant, I agree. That's why I made you do this. We never think that we need to introduce ourselves in any specific way. And I made you do this because that's one thing that you have to be excellent at. You think about yourself. Yes, when you start writing about yourself, you actually introspect and then you try to identify what am I good at. Ayush, आपका camera जो है, उसकी direction change हो गई है. I don't know what. This is better. Yeah, this is better. It felt good, and we would like to know about others more. Absolutely. So true. So true. So, see, this was a small activity I made you do, which must have left you with a lot of thoughts to know about yourself or to talk about yourself. I could also see some of you could introduce yourself very confidently. You could put the best part of yours in that 30 seconds. Some of us were still finding words to tell about themselves. How important it is to know yourself and to also give the right image to the next person, because a lot of time opportunities knock at your door without letting you know in advance. So I'll give you one incident that happened with me, and that's what, taught me the importance of introduction. So I had gone to attend a quality management program in one of the academies. I was one of the students there. I was a participant for that program. So the speaker who had come, he took everybody's introduction and each one of us introduced in our own way. So when my turn came, actually I had written my points, what I want to speak about myself. And in that flow, I just introduced that this is what I am, this is my background, and this is what I do. And then after this session, after the introduction was over, after the session was over, I was, we were having tea in a common place. So this person who had come as a guest faculty for the program, he asked me, he said, ma'am, we do program for doctors and we do 4 programs in a month. It was a Delhi government official who had come for the program. So he said, we do 4 programs in a month for doctors, and we are looking for somebody who can do the interpersonal and communication training for them. So will you be comfortable taking those sessions for us? It's a half-a-day program every batch, which I happily agreed. I did a program, just one I did to start with. And again, there the response came out so well that I did 500 programs in the next 2 years. 500 programs. And the programs that I am doing or I did or like I work on, that's absolutely a new area. We do not have well-set trainers who are working with the medical students or with medical faculty or with practitioners who are teaching them clinical communication or communication with patients and their family members. So you never know when opportunity knocks at your door, but your visiting card should be ready. And your introduction is your visiting card. So be very clear what you want to tell to the other person about you. Some of you really introduced very well. You were very clear why you're here. What do you want to do in life? What are your hobbies? What do you enjoy doing? So those who could not do it, let's learn from each other. Let's learn how to put across. And I can see it's a diverse group. I mean, people from all parts of country are there. That's so good. So there's so much to learn from each other. But a lot of us have language issues, which is perfectly understood. English is not our first language. Hindi is our first language. So एक चीज जो मैं कहती हूँ वो कम्युनिकेशन का बेसिक जो फंडा है वो ये है, बोलना सीखो. हिंदी में बोलो, अंग्रेजी में बोलो, कोई फर्क नहीं पड़ता. लेकिन जिस भी भाषा में बोलो, शुद्ध भाषा में बोलो, क्लैरिटी के साथ बोलो, कॉन्फिडेंस के साथ बोलो, क्रिस्प लैंग्वेज में बोलो. एंड यू शुड नो व्हाट यू वांट टू स्पीक. कंटेंट क्या है वो आपको बड़ा क्लियरली पता होना चाहिए. घबराने की जरूरत नहीं है अगर अंग्रेजी नहीं आती, सीख जाओगे, दैट इज सेकेंडरी, आ जाएगी. बोलना आना जरूरी है, क्योंकि बहुत अच्छे ऐसे स्टूडेंट्स हैं जो बहुत अच्छी अंग्रेजी बोलते हैं लेकिन कॉन्फिडेंस नहीं है तो नहीं बोलते हैं. सो दीज 5 years आर योर फॉर्मेटिव years. Work on these skills so that tomorrow when you establish yourself as medical practitioners, you don't only know your subject, but you know also how to communicate. Now, if I may ask you a question, any idea what is the importance of communication and interpersonal skills in your success, both professional and personal success? If I ask you in terms of percentage, what percentage of your success comes from your communication and interpersonal skills? Write in the chat box. Okay, 50%, 90%, 70 to 80%, 70%. Okay. What do others say? बोलो जरूर, अगर जवाब गलत भी है कोई फर्क नहीं पड़ता. अगर आपको सब कुछ पता होता तो ये क्लास की जरूरत नहीं थी. So even if your answer is wrong, it's perfectly all right. 40%, okay, good guess. 30%, good guess. Mridul, 50%, good guess. Nishan says 50%, again a good guess. 35%, बहुत precise बताया है कन्हैया ने. 30 नहीं, 40 नहीं, 35%. इसका मतलब है कुछ सोच के बोला है. Okay. You know, according to a study by Rahul says 50%. Oh, Lavish says 100%. A lot, actually. I completely agree with you. A study by Harvard, Dale Carnegie Institute, and Stanford University, jointly done by these 3 premier organizations of the world, indicate 85% of your success will come from your communication and interpersonal skills. All of you are at AIIMS Jammu, so it's proven that all of you are intelligent. But 10 years down the line, 15 years down the line, all of you will not be equally successful. Some of you may be really, really doing very well. Some may be average performers. Some may be actually at a very, very bottom line, even after passing out of AIIMS Jammu. And that will be majorly depending upon your communication and interpersonal skills. How? Let's understand. These 5 years in the college are your formative years. How you interact with your teachers, with your classmates, with your seniors will impact your learning. Those of you who are proactively interacting with the teachers, trying to keep pace with what they are teaching, and you're trying to ask questions and clarify things and understand things, will be able to have a better interaction with the teacher, better rapport with the teacher. So automatically your learning will be benefited. Some of us who are very quiet, who hesitate to speak, who hesitate to ask questions, they would be kind of not interacting with the teachers and fellow colleagues that much. So definitely your learning is going to get affected. Tomorrow, when you will work with your patients as students and as full-fledged doctors, 75% of your patient footfall will come from the patients who are satisfied with you. And again, patient satisfaction majorly comes from their communication with you. So if you are satisfied with the doctor, you'll go back to that doctor. If you're not satisfied with the doctor's behavior and communication, you will go to another doctor, because today when you're paying and availing this service, you will go to a doctor where you get that information and communication and proper treatment. So on these basis, I would say, you may know your subject very well. I'm not saying that you will not know your subject. After all, with so much of hard work you have been here, you are here to do your part of learning. But then that's not enough. So please remember your communication skills and your interpersonal skills, how you get along with your teachers, your friends, seniors, because a lot of learning happens from seniors also, patients, their family members. All that is going to impact your learning. So take this seriously. Now, if I may ask you to evaluate your existing communication and interpersonal skills, again in terms of percentage, write in the chat box so that we have an idea where we stand to start with. Should I repeat the question?
Yes, ma'am.
Where do you see yourself right now in terms of your existing communication skills and interpersonal skills? Write it in terms of percentage. So is it 100%? Is it 20%? Is it 10%? 30%? 40%? Where do you see? So Ayush, you have said 1%. 1 या गलती से तो नहीं टाइप हो गया?
नहीं मैम, ये intentionally किया 1%.
Lavish says 40, Prachi says 40, Nishant says 20 to 30, Kanaya says 60%, Meena says 30, Prachi says 40, Mridul says 20, Mansi says 30, Rahul says 45, Manya says 40, Manish says 50, again Mohit also says 40 to 50. Preeti says 20%. So you can, clearly imagine how much of hard work we have to do to work on our skills. And it will not automatically improve. Let me also remind you. Don't think that aa jayega, ho jayega. Yes, 10 to 15 to 20% will improve, because when you are interacting with classmates, interacting with teachers, definitely you are bound to, learn. But then it's not going to be drastically different from your existing communication style unless you really, really work on it. So, if I may say, there are 4 stages of learning. The first stage is unconscious incompetence. That means we didn't know that communication skills are very important. We didn't know that communication skills play a very huge role in our life. So as a result, we never thought that it is important to work on the communication skills. So that first stage is unconscious incompetence. I didn't know that, okay, my communication skills are just 20 to 30% or 40%, or somebody said 32%. Ayush says 1%. Now we are having a discussion. We are getting to know the importance of communication and interpersonal skills. And we are getting to realize that these play a very big role in our success. This is the second stage of learning, and that's called conscious incompetence. That means I've become aware of the fact that my communication skills are not really satisfactory. They are not good. I really need to work on them. So now you have become aware of the fact. The third stage is conscious competence. Conscious competence, where you will make efforts to work on your communication. So after today's class, I'm sure you will proactively interact with your teachers. You will proactively participate in the classroom. You will be forthcoming in your, questions, concerns, ideas, thoughts with your teachers, with your batchmates. Because you know that's the only way to improve my communication skills and interpersonal skills. It's only by doing. Reading will not help. Reading will not help. It's only by doing, by performing, by getting into the classroom. Once you will work on it, and we have good 5 years time. If this is your primary, focus besides your clinical skills, I'm sure you will be able to work on your communication skills. The fourth and the final stage of learning is unconscious competence. Stage where you will actually be communicating very, very impactfully. So whenever you will interact with your teachers, with your friends, with your patients, even at home with your family. So whatever we are learning or discussing here is equally applicable in your personal life. So when you interact with your parents, with your siblings, with your friends, the rules would remain same. And when you are able to express yourself confidently, like I took your introduction, and if I need to pick 5 students from your batch who are here, it's just a matter of 5 minutes for me to identify who 5 I need to take. Naturally, those who would speak well, those who can express well, those who have confidence. So this is how your growth chart will be different. Automatically, for responsibilities, for roles, for initiatives, students who are doing well will be picked up. So naturally, if I have not been able to speak well, and even in introduction, I'm not identified as a good speaker. So I lose the opportunity to grow further. For example, in the classroom, when your teachers will interact with you, and if you don't ask questions, if you don't speak up, if you have not come prepared for the class, teacher will not even identify you as one of the students who is very serious. On the other side, students who will actually be, coming prepared for the class, or will ask questions, or will answer questions, they will be identified. Automatically, they will be given more responsibilities, more opportunities, more challenges. So you can see their growth chart. You are responsible for your growth. Nobody is going to give you an equal opportunity. This is not a world of equality. Very honestly, write this in your notebook. You will have to work hard to get the opportunity if you want to grow. This is a world of inequality. It's not like mother who would give equal food to both the kids. It's only parents who would make sure that both the kids should get, or all three kids should get the same thing. In all other spaces, you are going to experience competition. I'm not asking you to get into unhealthy competition, but making a better version of yourself will automatically promote you, will increase your opportunities. Do you agree with me? Is it making sense?
Yes, ma'am.
Yes,
Yes, ma'am.
So this, if you will take this seriously, this is actually going to completely change your perspective towards yourself and the way you handle situations. And once I will discuss about the communication styles with you and your scores on communication styles, I think you will understand better the way you are communicating right now, and then what is the right way of communicating. We are going to speak that at length. But this was the groundwork I needed to do to help you understand the importance of communication. It takes me almost an hour to help you to understand what it is, but it's perfectly all right. I know this is something we don't value much, we don't consider much because we don't know. So tomorrow, why talk of this college? Even if you look at home, in case if you need help from somebody, from your relatives, whom would you prefer going for advice?
My parents.
Among the parents, on
Mother.
what basis you decide? Mother, because she's able to communicate with you, she understands you,
Yes,
she's
ma'am.
able to respond to you effectively, isn't it? So
Yes, ma'am.
tomorrow when you will have your faculty, or if you have to consult for any one of your family member and there are two faculty members with the same qualification, same designation, you will prefer going to the faculty who is actually good to speak to, with whom you will feel comfortable, with whom you'll feel like interacting. So that's how your whole growth chart gets designed. So with this background, let me now quickly ask you another question. So you all have a copy and a pen?
Yes, ma'am.
Draw a circle, and in this circle write me. That's you. Draw a circle, and in this circle write me or I, whatever. Draw another circle outside it and write the names of the people. If not aims, you can write initial also, because writing name will take longer. Write the initials of the people who are closest to you, like who will always be there with you, to help you, to guide you, to support you, to like kind of go-to people. Then draw another circle to write maybe the second line of people whom you think of will be help to you if you need any help or guidance or support from them. So one is your immediate circle. Second could be your kind of people whom you can still kind of consider they will, be of help to you. Done? Done?
Yes, ma'am.
Okay. So who are in your immediate circle? The first circle? Family? Mostly?
Family. Yes, ma'am.
Mostly family.
Yes, ma'am.
Also some close friends?
Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
Yes, ma'am.
Usually we keep parents, siblings, and very close friends in the circle 1. And who all are in the outer circle?
Batchmates.
Okay.
Yeah,
Batchmate.
cousins and
Seniors and
close
teachers.
friends.
Seniors.
Yes.
Mhm. So when you are in hostel and in college, actually this circle will reverse.
Yes, ma'am.
So in case, God forbid, if there's any situation that you need immediate help, you will get and you can get help from your teachers, batchmates, seniors, and other caregivers in the college and hospital and hostel. But that will not happen automatically. That will only happen if you have worked on developing good relationship with all of them.
Yes.
So it's very important to create that support system around you where you can trust your teachers, your batchmates, your seniors, and caregivers to be available in case if you need help. Of course, family and other members of the family are there. They are just a call away. But suppose if I have an urgent need now, they can't be physically here immediately. So keeping that in mind, it's very important to proactively value this relationship with teachers and with your batchmates and seniors and caregivers. I'm including even caregivers because even they are a huge support system. So how do you think you can develop good relationship with all these this category?
Ma'am, by regularly interacting with them, asking about their health, how they are doing in academically and other fields of life.
So that means it's important to proactively connect with them. So how many of you have actually interacted with all of you, with all your classmates in real sense? Raise your hand. Not much. So is it easy or difficult to connect with people? I can see two hands. Okay, I can see two hands. Is it easy or difficult to connect with people?
It requires an effort.
Okay. I'll put you in a breakout room with one partner and you have 3 minutes time. In those 3 minutes, for 1 minute, one person will be speaking, the other will be listening attentively. Then the second minute will be when the person who was listening will speak and the person who was speaking will listen attentively. And last 1 minute is to come to a conclusion. What is our takeaway from that discussion? And the prompt for that discussion is how hard you have worked to be here. I'm sure you have something to share with each other, something very, very, important to you, something very close to your heart, because all of you have done a lot of hard work and you want to talk about your, side of story. So you get total 3 minutes time to do the activity. And then once you do the activity, we will have a reflection on it. Ayush, do you want to say something, or this question was this hand was raised because you wanted to say that I have interacted with friends here?
I have interacted with friends.
You haven't. I can understand. Great. So I'm putting all of you in the breakout room at random. I am not like choosing anybody to be with anybody. So 1 second. We are, okay, 16. So 8 groups. So you will get the option to join the breakout room and you have to click on that option so that you can be in the breakout room. Yeah. So all others, please click on joining the group so that you can be in the group. 4 of you are in the same group, so please go to the group that you need to join. So Preeti, you need to join one group. You got the option to join the breakout room. So say join the group. Yeah.
सारा फिर मिल गया।
So you are back. Ayush?
Okay.
So who all could do the activity? Raise your hands. Who all could do the activity? Only 2 people could do the activity? 4? You can raise your virtual hand. That's better. I can count. Manya, virtual hand. Virtual hand.
Okay.
That helps in counting the number of people who are doing the activity. I can see 5 people have raised their virtual hand. प्राची आप नहीं कर पाए? प्राची नारवाल, you couldn't do the activity? Okay. प्रीति आप नहीं कर?
I raised my hand virtually.
Okay. No, virtually वाला जो है वो ये वाला hand है जो
हाँ, मैंने वो भी किया था पर I lowered it.
Okay, it's okay. कन्हैया आप कर पाए नहीं कर पाए? Unmute. नहीं कर पाए? ओके, जो लोग नहीं कर पाए, अब बाकी सब लोग अपना हैंड लोअर कर लें. जो नहीं कर पाए वो अपना एक बारी हाथ खड़ा करें. जो कर पाए वो अपना हाथ लोअर कर दे. कन्हैया नहीं कर पाए. प्रीति आप भी नहीं कर पाए? अनम्यूट योर डिवाइस और कैमरा थोड़ा ऐसे रखो so that I can see you. I'm not able to see you. I can see your roof. I can't see you. Thank you. मृदुल आप भी नहीं कर पाए मेरे ख्याल से. राहुल
Yes,
आप कर
yes.
पाए? नहीं, आप भी नहीं कर पाए. बाकी लोग? निशांत आप कर पाए?
जी मैम.
ओके. जो लोग नहीं कर पाए, क्यों नहीं कर पाए?
मैं वो पता ही नहीं था करना ये.
प्रीति आप क्या कहते हो? क्यों नहीं कर पाए? प्रीति, am I audible to you?
यस मैम.
आप क्यों नहीं कर पाए बेटा?
मैम पता नहीं था क्या करना है.
मृदुल आप?
मैम डिस्कशन थोड़ी सी स्टार्ट की थी इनिशियली, फिर
राहुल आप क्यों नहीं कर पाए?
सेम थिंग मैम, एज इज कन्हैया.
हाँ, क्या हुआ?
मैम पता नहीं था. आई डोंट एनी आइडिया.
So this is what happens. We think we communicate, but communication does not happen. बहुत बारी जब आप पेशेंट हैंडलिंग करोगे ये चैलेंज आपको आएगा. आपने अपने पेशेंट को कुछ एक्सप्लेन करा, उसे समझ नहीं आया, लेकिन उसको हेजिटेशन होगी आपसे पूछने में कि क्या बोल रहे हैं, क्योंकि बाकी सबको समझ आ गया, मुझे समझ नहीं आया, तो क्या दिक्कत है, मेरे साथ कोई चैलेंज है क्या जो मुझे समझ नहीं आया. And when you don't ask, when you don't clarify, you will not be able to do the task. जब तक प्रोएक्टिवली पूछोगे नहीं, सामने वाले को नहीं पता लगेगा कि आपको समझ आया कि नहीं आया. Okay, those who could do, what was the experience? आप लोग अपना हैंड लोअर कर लीजिए प्लीज, वर्चुअल हैंड लोअर कर लीजिए. जो कर पाए उनका क्या एक्सपीरियंस था? if one or two of you could unmute and speak.
Ma'am, it was nice knowing the journey of our fellow batchmates. How have they come from, how have they prepared for their exam and they come here? Because we did not talk about our individual journeys earlier, but now we know more about each other on that basis.
So anybody who interacted for the first time with the person with whom you were in the breakout room? कोई ऐसा पेयर हुआ जो कि पहले उनके साथ बात ही नहीं हुई, पहली बारी आप उनसे बात कर रहे हैं? Anybody? कोई अपना और एक्सपीरियंस शेयर करना चाहे, कोई और बताना चाहे कि क्या लगा, कैसा लगा बात करके? Manya, what was the experience?
Ma'am, it felt like we had more or less the same same experiences through the journey. So it felt good knowing that we went through almost the same thing.
True. कोई और कम्युनिकेशन के बारे में समझ आई हो? नाम लेके बताने की जरूरत नहीं, जनरली क्या क्या समझ आया एक दूसरे के बारे में? So मैंने सिर्फ हाँ बोलो please
that
go ahead.
we both worked hard for getting into AIIMS.
Exactly. There's no doubt about it. But at the same time आपने ये भी ऑब्जर्व करा होगा कि किसी के कम्युनिकेशन स्किल्स बहुत अच्छे हैं, किसी के कम्युनिकेशन स्किल्स बहुत अच्छे नहीं हैं. कुछ लोग बहुत अच्छा एक्सप्रेस करते हैं, कुछ लोग नहीं करते हैं, कुछ लोग की लैंग्वेज का बैरियर हो सकता है. But if you really want to connect with each one of you, you will have to mindfully let go of these barriers. अगर कहीं लैंग्वेज बैरियर लग रहा है तो प्रोएक्टिवली उस बैरियर को आपको क्लियर करना है. अगर मुझे दिख रहा है कि कुछ बच्चे अगर अंग्रेजी में नहीं बोल सकते, इट्स परफेक्टली ऑल राइट अगर मैं उनके साथ हिंदी में बात करूं, क्योंकि आइडिया ये है कि आप लोग बात करें. सो क्लासमेट्स के साथ आपको ये देखने को मिलेगा, क्योंकि ये मिक्स ग्रुप है, डाइवर्स ग्रुप है. Students will be coming from various backgrounds, different socio-economic background, different language background, family circumstances फर्क होंगे. Proactively you will have to let go of those barriers so that you can connect with each other. और अगर ये सब बैरियर को हम लुक आफ्टर कर सकते हैं तो we can become a batch of real good friends. Family, सिबलिंग्स सब बाद में आएंगे, पहले ये फ्रेंड्स और कॉलेज की जो फैकल्टी है वो आपके काम आएगी. So I gave you just 3 minutes to connect with each other. Some of you proactively did, some of you did not do it. But you have full 5 years to connect with your classmates. And let me tell you, अगर आप सोच रहे हैं कि हो जाएगा, ऐसा नहीं होगा. आप ऑब्जर्व करिएगा, in a span of couple of months, you will have just handful of friends with whom you will interact. बाकी सबके साथ hello, how are you तक रह जाएगा. On the contrary, if you connect with lot of friends, you will have lot of people who are there to help you, to support you, to guide you, to provide you things that you require. So this brings me to a very beautiful concept called Johari Window. किसी ने सुना हुआ है ये concept? Johari Window? नहीं सुना हुआ? तो जो एंड हैरी दो सोशल साइकोलॉजिस्ट थे. उन्होंने ये कॉन्सेप्ट दिया कि हमारी पर्सनालिटी को हम 4 पार्ट्स में बांट सकते हैं. लेट मी शेयर दिस स्क्रीन एंड एक्सप्लेन टू यू. Is this screen visible? Okay.
Yes,
So
Yes, ma'am.
yeah. So इसको collectively जोहारी विंडो के नाम से हम बुलाते हैं, लेकिन actually they were two English people, Joe and Harry. So इन्होंने ये कहा कि ह्यूमन पर्सनैलिटी को हम 4 पार्ट्स में बांट सकते हैं. सो पहला पार्ट वो है हमारी पर्सनैलिटी का जिसको हम पब्लिक सेल्फ कहते हैं, और जिसमें मतलब है कि पार्ट ऑफ माई सेल्फ विच आई नो एंड अदर्स ऑल्सो नो. सो जैसे आप एक दूसरे के साथ इंटरैक्ट करेंगे, यू विल नो अबाउट ईच अदर एंड दैट विल बी पार्ट ऑफ पब्लिक सेल्फ. Then there's another part of ourself that is we know but others do not know. So definitely there will be some portion of your life that you will know but your friends and others will not know, and we call this as a private self. I think each one of us will have that private self because there will be things that you are not very comfortable sharing with others, and we just like to keep it to ourselves. It could be related to your family, it could be related to finances, it could be related to anything of your personal life. There's another part of our personality that's called blind spot, and blind spot is which others know and I don't know. So surprisingly, there'll be a lot of things about yourself which others will be able to tell you more precisely than you actually knowing it. Either you will not know or you will not be able to believe that, okay, this is me. And that's normally called blind spot. The fourth part of our personality is called area of unknown activity. So that is neither I know nor others know. Studies suggest that people with a larger public self are better able to deal with people and have a good life, because when you have a larger public self, that means you are more like a transparent person where there is very minimum that you would actually not be sharing with others. So it's very important to remember, if I want to have people around me, if I want people to like me, love me, enjoy my company, be with me, then I need to have a public self, larger public self. Now, people with, bigger private self, I'm sure you will find people who have bigger private self and smaller public self. So as a result, they are keeping a lot within themselves. A person with bigger private self will have difficulty getting friends, क्योंकि लोगों को हमेशा ये लगेगा कि आप बहुत सीक्रेटिव हैं, आप ओपन अप नहीं होते, आप अपनी बात बताते नहीं हैं, आप लोगों के साथ कनेक्ट नहीं करते हैं, अगर आपसे कुछ पूछा जाए तो आप एक ऑनेस्ट आंसर नहीं देते हैं. So people will start distancing from you if you have a larger public self. On the other side, if you have a bigger blind spot, you can see blind spot area is bigger. That means if you have weaknesses like, for example, anger issues है, या बहुत egoist है, या बहुत aggressive है लोगों के साथ में. So you don't know that you are aggressive or you're short-tempered or you ill-treat people, but others can sense it from your behavior. So that becomes a blind spot for us. Again, ऐसे लोगों के साथ हमें इंटरैक्ट करने में दिक्कत आती है, and we try to distance ourselves from each other because we feel कि नहीं, इनके पास जाने का फायदा नहीं है. ये जैसे कुछ लोग जैसे झूठ बोलते हैं, या कुछ लोग बहुत ज्यादा मैनिपुलेट करते हैं, या बहुत इधर की बात उधर करते हैं, या पीठ पीछे बुराई करते हैं. They're all our blind spots. So we don't know that, but as a result of this, people will not like our company. They will not be really wanting to be in our company. So if I may ask you, what is the way to reduce your private self? Because ultimately, अगर हम 5 साल इकट्ठे रहने वाले हैं, तो we have to have, a private self, which is more like, of course, we all have private self. How can we have a larger public self? Write something in the chat box that you think can help you reduce your private self and increase your public self area. Write in the chat box. Very good. By communicating on daily basis, we have to interact with each other and spend time with each other. Okay. Through communication and reciprocating feelings and efforts. Very good. Any more thoughts? By interacting and by talking about yourself and also listening to others. Absolutely. By interacting more with our friends and sharing our thoughts. Absolutely. Mm-hmm. What do others say? Okay. By interacting with each other frequently on daily basis, by helping out and asking for help without hesitation. Absolutely fine, Manish. I think that's a wonderful thought. Increasing interaction with others and being a part of what they share. With knowing each other and communicating with them by sharing our thoughts, by interacting more with our friends and sharing our thoughts. Okay, great. I think that's a wonderful thing. So it's good to have a small private self. That does not mean that you go out and share everything about your personal life with everybody. So again, here, it's important to connect with everyone, slowly observe people and see how trustworthy they are. So in a batch of say 50, 60 students, you'll definitely find 2-3 people who can be trusted. So to start with, you can share some information that you think is not that confidential, but you can comfortably share. So there will be a set of information which is out and open and you can always share with anybody. If somebody comes and asks you about something and you think there's nothing to hide, be open and honest and share about that. But then there will be a set of personal information which you would not like to share with anybody. But you should always have some go-to people with whom you can share your concern. And mostly it will be your batchmates and your friends. Because on daily basis, you will require some guidance, some support from them. Of course, it's good to be in touch with your parents. Keep them informed about what is happening in your life. If there are some ups and downs, and if they know, they will definitely be able to guide you because you can trust them with anything and everything. Right now, they are your support system, but you have to create a parallel support system in your college. So between friends, you'll be able to identify people who appear to be trustworthy. Maybe you'll share some set of information with them and see, do they really go and talk about you to others? And then slowly over a period of time, you will know each other. But it's important to remember that if I really want to become better and have a larger public self, I have to reduce my private self, because larger private self means you are carrying burden on yourself. So initially it can be just your family members and very close friends and your people whom you trust, but then ultimately you will have to develop the same system in the college also. Now, once you share your problems with your friends and your family, what happens? What happens? Any guess? When you tell your mom that this is the problem I'm facing in college, what happens next? Do you get some response from them?
Yes, ma'am.
Initially, she'll be concerned, but then she'll also try to solve it and maybe console us if we are not feeling okay about it.
Mm-hmm.
And she'll always try to give a solution to our problem.
Absolutely. So that means when you will confine into somebody, most likely that person will give you some feedback, some solution, something that you are okay, something that you haven't done well. For example, if you say that in the classroom, this thing happened and I had an argument with another batchmate. That's possible because you are going to be together for so long. So there will be place times when you will have an argument with your classmate. So when you will speak to your mom and you'll tell, Mom, this happened in this class today, and I had an argument with my classmate, and it really turned into a very heated argument, and I'm very upset about it. So most likely she'll come out with, of course, consoling you and calming you down, and then she'll give you feedback. I think in the classroom, it's not good to have such kind of arguments because you're going to stay with them for 5 years. So it's not a good idea to create such enmity. And I think you have some anger issues also. You have to really learn to control yourself. So in a very subtle way, that person has given you a feedback about your blind spot. If you want to grow in life, if you want to become a better person, it's very important to admit what you are not doing right. If you're not participating, if you're not speaking, if you're not, interacting, and if you're not sharing this with your family, friends, and your classmates, your private self is not going to go down. So none of us is perfect. None of us is perfect. We may have language issues, we may have behavioral issues, we may have difficulty connecting with people, we may have hesitation that others will laugh at me or they will make fun of me. That's perfectly all right. But this is a playground where you are here to learn. The actual battle is after you clear your college. Real life will start once you'll be out of the college. So it's more like, you are here to practice your skills. So if you really want to work on yourself, very consciously, you will have to reduce your private self. Go to your go-to person and admit. अब जैसे यहाँ पर भी हम participate करें और कुछ लोग नहीं बोल रहे हैं, talk to your family and tell कि इतने सब लोग बीच में मैं नहीं बोली या मैं नहीं बोला. You will definitely get some feedback from your friends or your parents that what is the way to improve your confidence. And then that will help you reduce your blind spot. So whenever you will share your weakness with the other person to whom you trust, you will be able to get some feedback from them. So, okay, this we can skip. Yeah, this is the one. Now, how do you create larger public self? One is self-disclosure, admitting that I lack this, I lack confidence, I lack language skill, I lack the behavior that I need to really exhibit in the class. So when you will speak about your weaknesses with your friends, family, and close friends, they will help you with some feedback. That will help you to grow, to work on yourself. So when you do this activity on regular basis, I'm not saying go on the crossroad and start saying, okay, these are my weaknesses, or this is what are my challenges. But with somebody with whom you are comfortable talking, do go and talk to them about what are your challenges. If you're feeling low, if you're feeling unhappy, if you're sad, if you're feeling anxious, do not hesitate telling about this to your friends or to your teacher or to your parents. So that will help you reduce your private self. A lot of time we keep these things in ourselves. So that's why we get stuck in this situation. So through self-disclosure and feedback, you can actually improve your public self. And you will see people who are doing well in life, they will mostly have a larger public self. They are more transparent, more open, more vocal about their thoughts. They listen to others. They express themselves in a more honest way. And all these things can be learned. This is just the beginning of life. Especially, I know medical students, right from say your 9th class, 8th or 9th onwards, you become so focused on studying that these skills do not get a chance to, actually get grown. But don't forget that these skills are very important. So college time is the best time to work on these skills, work on your hobbies, work on your weaknesses, so that you can actually grow as a beautiful human being and not like a closed personality. So those of us who will not work on ourselves, we will enter as a closed personality, will go out as a closed personality. And life will not give you a second chance to work on your personality. But if you make use of this chance, work on yourself, work on your personality, identify what are your weak areas. It could be language, it could be communication, it could be behavior, it could be anger, it could be feeling sad or anxious, it could be anything. Address it, work on it, talk about it, take advice, and then try to work on it. A lot of us actually handle situations in a very typical manner. And the questionnaire that I gave you actually was all about how do I handle my situations. So do all of you have all your scores ready? Those 4 scores after totally?
Yes.
Yes, ma'am.
So in the chat box, please put your scores with a comma in between. Is there any student in your class with the name Prince? Or Princey?
No, ma'am.
Prince or Princey? No? Okay. So all of you have put your scores? Anybody who has not entered, please raise your hand. Lavish, you haven't done or you have not?
मैम मेरा टोटलिंग वाला पार्ट रह गया था वो मैं अभी कर रही हूं
ठीक है कर लीजिए ओके सो पायल आपका स्कोर आपने डाला है 10 11 14 20 इज दैट करेक्ट चेक करो सो योर फर्स्ट स्कोर उसी ऑर्डर में डाला है ना जिस ऑर्डर में टोटल करा है पायल एक बारी कंफर्म करो अपने स्कोर्स प्लीज because I'm not finding your scores okay, so I'm asking you to clarify. Payal, can you hear me? Can you unmute your device and reply, Payal?
Yes, ma'am.
So the scores that you have put, you are clear about them? They're exactly in the same order? Payal, is there any challenge in understanding what I'm saying? आपको मेरी बात समझ आ रही है पायल?
Yes, ma'am.
आपके स्कोर्स जो आपने डाले हैं, you are okay with those scores? ठीक है वो स्कोर आपके?
Yes, ma'am.
Okay, thank you. So can I request everyone to have their camera on? So we all handle situations in 4 different ways. A lot of us, when we are in a difficult situation, we just become quiet and do not take any stand. And that is called passive communication. So you can see even in the class right now, some of us are not taking part. Some of us are not coming forth. Some of us are not participating. Some of us are not even replying. Some of us are not asking questions. That's called passive communication style score. So your second scores, you can write in front of the second score. Your second score is your passive communication style score. Again, in a lot of situations where we are not able to speak up and express ourselves, but we feel bad, we are unhappy, we are cribbing. For example, somebody said something, you didn't like it, but you did not reply, but you are unhappy within yourself. This again happens a lot of time with us. And that is called passive aggressive communication style. That means overtly you are quiet, but inside you are aggressive, you are unhappy. So your third scores are your passive aggressive communication style score. Some of us easily become aggressive, we become loud, we start fighting, arguing, or we start becoming aggressive with people. And that's aggressive communication style. And your fourth scores are your aggressive communication style score. To a lot of situations, we are able to handle very well, and we are able to reply or participate or express in a very honest manner. And that is called assertive communication style score. So your first scores are your assertive communication style scores. You can see it for yourself. Most of you have scored highest on assertive communication style score. So that means at least the foundation has been laid. But there's a twist to the story. The twist is, in most of these situations, you will try to assert. But wherever you think assertion is not working, you are likely to go down to the other style of communication. And what is that? Which is your second highest communication style. So if you may look at your scores, for example, if I look at Mridul, your scores,
Yes, ma'am.
you try to assert, you're assertive, but in case assertion does not work, you are most likely to become passive. You take a quiet stand, you withdraw from the situation. Do you agree with me?
Yes, ma'am.
Okay, if I take another example, Kiran, in your case, your primary score is passive because 18 is highest for you. Your scores are 13, 18, 10, 11. So your passive scores are 13, which is very worrisome, let me tell you. If I'm taking passive approach in my interaction with people, that means I am not proactive in my approach. So that's something serious and we really need to reconsider. And you primarily use passive communication style in most of the situations. Do you agree with your scores and interpretation? Kiran, I'm asking you. Please
Yes,
respond.
Yes, ma'am.
So we need to work on it. We really need to work on it. Okay. So if I go by Kanhaiya, in your case, you will primarily try to assert. You will be assertive in your communication. But in case that does not work, you're likely to become aggressive because you have second highest scores on aggression. And mostly in stressful situation, our real communication style comes out, real nature comes out. Assertion is a learned skill. But little pressure on us, our real nature would come out. So you really need to work on it because aggression is unhealthy for yourself. So Payal, why I asked you for your score specifically, because I was a little concerned and I'm still concerned. Your highest score is aggression, which is 20, whereas all other scores are very different, 10, 11, 14, and 20. So are you aggressive by nature, Payal?
Yes, ma'am.
Again, it's worrisome, Payal. If that's your nature, you will have difficulty getting along with people. You will have difficulty having people on your side. Because if I'm aggressive in my approach, people will not be comfortable with me. They will not enjoy my company. They will hesitate being with me because I'm aggressive. I can shout at them at any time and I can misbehave with them at any time. So they will not feel comfortable being with me. The good news is this scores can be changed. You can work on yourself. We will be talking about it in the next session, not here. I have a very beautiful presentation to explain you all 4 styles and then learn what is the right way of doing it. So the idea of giving you this questionnaire was to make you aware of your ways of handling situation. So if I look at other scores, for example, Nishant, if I look at your scores, where is Nishant? I need to identify where he is. Nishant,
Yes,
if I look at your scores are very, very encouraging. Your highest score is 20, that is assertion. Your aggression score is 11, but there's a huge gap. And if you will work on your aggression, you will actually be able to handle most of these situations very effectively. Only thing is, stick to assertion. And I'll explain you what assertion is and how do you enhance and establish assertion as the way of communication. And once you will learn this skill, you will feel so happy and confident and comfortable with yourself, because you will not hesitate speaking anywhere with confidence while keeping others in considering others' feelings and others' thoughts. So assertion does not mean being aggressive or being rude with people. Assertion is being able to say what you want to say in a respectful manner, in a cordial manner, but still put across your thoughts in the right manner. So I'll just quickly have a look at 1 or 2 more scores. Manish, even your scores are encouraging. 19, 7, 12, 11. It's good because your assertion scores are highest and other scores are much at a gap, but you can work on it. So if I look at Prachi Narwal, your scores, although your assertion scores are highest, which is 16, but there's a scope to grow. So if you further work on your communication, I'm sure your assertion scores can be improved. So you can work on that. What else? Okay, Lavish, in your case, you have written 16, 8, 13, 13. So again, 16 has a scope to go to 20 because highest score is 20. So you can improve your assertion scores. At the same time, your two scores, 13, 13, that is aggressive score and passive aggressive score, are high. So in your case, assertion does not work, you are likely to move to either becoming aggressive or becoming passively aggressive. So that's not helpful. We will talk about the advantages and disadvantages of each style and how that will hamper your growth as an individual. In the next session, we will discuss at length. So anybody who wants to discuss their score that I have not talked about? Okay, Ayush. So Ayush, if I look at your scores again, your assertion scores are high, that is 90. And in case assertion does not work for you, you are likely to use any of the three styles. Either you'll become passive, passive-aggressive, or aggressive, depending upon the situation, depending upon the person with whom you are interacting. Or, for example, if it is your teacher, maybe you will take a passive stand. If it's a classmate, you will take a passive-aggressive or aggressive stand. If it's your senior, you may take a passive-aggressive stand. But again, your scores are good because your assertion score is very high. So work on improving your assertion and reduce your other scores so that your passive and passive-aggressive and aggressive scores further go down. For most of you, your assertion scores are high, but then let me remind you that the other scores, when they are in the range of 10, 11, 12 and more, they are equally active. They are equally, they are the second choice and they are more likely to come depending upon this situation. Kiran, I think I've explained you about your scores. That's little worrisome. I would ask you to work on it. Preeti, if I look at your scores, who is Parneet? So did she get? Okay. So Preeti, if I look at your scores, again, your highest score is 20, which is on assertion, but your second highest score is passive communication. So in your case, by the way, where is Preeti? Yes, there you are, yeah. So in case assertion will not work for you, you are likely to move to the other style, and that is passive communication style. You will withdraw from this situation. Do you agree with your scores, Preeti?
Yes, ma'am.
So we will discuss these scores once again in the next class, and that is, when is it? Saturday?
Yes, ma'am.
Yeah, Saturday. So we'll discuss this course once again, and I'll also share a presentation with you to help you understand more about this course. And let me tell you, if you're able to learn this style of communication, most of the things in your life will fall in place in your personal and professional relationship. You'll really, really enjoy, these skills, but they're little difficult to learn, but once learned, they'll do a great job for you. Any questions about what we have discussed till now? Okay, so if I may ask you to quickly put your feedback in the WhatsApp group, the takeaway from today's session, just quickly do it right away so that I know what is your takeaway from today's session. And then we close the session. Go ahead. Please write your takeaway in the WhatsApp group that we all are a member of. Yeah.
Hello,
yes.
ma'am.
Yeah.
Ma'am, I will not able to take class on Saturday because I have to travel to Delhi. So can I attend class with other batch on for second?
Ayush, you can do it. Only thing is, see, sometimes a portion of the session is covered in session 1, and sometimes some portion is covered in the second one. So I don't know whether I'll be able to cover the presentation for the next batch in session 1 or session 2. So it's your choice. In case if you cannot join at all for that reason, then you can join the next batch. But this call you should have taken, rather than joining this batch. You could have joined batch 3 or batch 4 or batch 5. That would have been better. So it's your choice. In case if you're traveling to Delhi on Saturday, you're saying?
Yes, ma'am.
And what time is your train or like how are you traveling?
Ma'am, 10 a.m. 10 a.m. I will departure. My train will departure at 10 a.m. and reach by 5 p.m.
I know. So you have to take a call how you want to deal with it. I can't really be clear. Yeah.
Okay. Thank you, ma'am.
So meanwhile, if you can all, add your thoughts in the.
Okay, ma'am.
I hope you're writing in the WhatsApp group. You're learning from the session and takeaway. So I'm closing the group here. You can finish writing in that, and that will be more like your attendance for the session. So write your feedback in the WhatsApp group and take away. Is that okay? So I'm closing the session here, and write your feedback and take away in the WhatsApp group. Thank you. See you on Saturday.
Thank you, ma'am.
Thank you. Bye.